Rotator cuff tears and rotator cuff tendonitis are some of the most common problems that can happen to the shoulder that can cause pain and disability. What's the best way to treat those problems without resorting to surgery? The mainstay for treatment of rotator cuff tendonitis and rotator cuff tears, as long as they're small and not progressive, is number one, to maintain or regain the range of motion of the shoulder. Make sure the range of motion is improving and getting better and not getting worse. And number two is strengthening the shoulder rotator cuff muscles. So the stretches that we can do that with Kyla here. So the stretches that we do the shoulder, one of them is the nice, easy, lazy stretch. Okay, so we're gonna put the head back and I'm gonna have you lay down just flat, Kyla, if you can. So, and if you can slide down the table just a little bit and pretend that you're having trouble with your range of motion in your right shoulder. So we're gonna try to stretch that shoulder. So we're gonna use your left hand behind your right elbow and try to go all the way up slowly. And then try to get your biceps to touch your ears. You can keep looking up and straight forward with your neck now. And keep stretching that. So here, you know, when you're having stiffness for Kyla, it's easy to take the shoulder back. A lot of patients with shoulder cuff tears or cuff problems, they may be stuck at this angle or this angle. So what do you do about this? You're going to feel some discomfort when you're doing this. So when you take in the inhale, you try to create some pressure against the elbow to push the shoulder back. And when you exhale, you try to relax the muscle of the shoulder girdle and of the shoulder. So it's a biphasic exercise. And you stay in that position for as long as you can, maybe 20 breaths or 30 breaths, but you're using your breath as energy, the inhale for awareness and for applying a little bit more pressure to regain that range of motion. And the exhale is taken to relax the shoulder joint so you can get a little bit more range of motion, but you maintain that stretch for as long as you can. That's the first primal range of motion we need to regain, is that forward flexion abduction. So, and there's multiple other exercises. The most important for shoulder is called the sleeper stretch. And for that one, now if you can lay to your side, Kyla, and put your elbow in front of you. Good. So the sleeper stretch is where we gain the rotation of the shoulder joint. One of them is the external rotation, the other one is the internal rotation. So we use the good side around the wrist and you try to push. And again, here you're gonna meet stiffness. So with the inhale, we create a little bit more pressure to make the hand go down towards the table. And with the exhale, again, we try to relax around the shoulder girdle. And we repeat that. Inhale, effort, exhale, relaxation, and breathing through the nose so you can relax your musculature and get more effective with doing this. Now, this is the sleeper stretch for external rotation. Then we can go ahead and do the one for internal rotation. Same thing around the wrist, and you're pushing. And with that inhale, you create a little bit pressure. And with the exhale, you relax and you repeat 15, 20 times to regain range of motion. Now, if you can sit up, Kyla. So the second most important thing, so this is for gaining range of motion, both forward flexion abduction, and then gaining the range of motion in rotation, and then the strengthening. So the strengthening, most people, when they're raising their arm up and they have cuff problems, they have pain when they put their arm high. So the best way to avoid the pain is to lay down reclined 45 degrees, just like Kyla is doing right now. So now if we lift that arm from here to here, you're not lifting it to the painful level, but only halfway. And now we do small circles. That's the therapy for the rotator cuff. That's how to strengthen the supra-infraspinatus, subscap. Small circles, and then we can do that maybe 20, 30 times. And if you get tired, you just can hold it still for isometric strengthening. And then you can go the other way around. So do it clockwise, counterclockwise. And we try to do this at 3 angles. First, straightforward like this, and then we move it out like this, and then repeat the same thing. Again, maybe 20, 30 repetitions and sets of a couple of times a day, 4 or 5 days a week. And then we can do that in a little bit more abduction, and same thing clockwise and counterclockwise. As the shoulder improves and there is less pain, we can sit up higher and higher and do this more in the seated position if it becomes comfortable to do that. But in the beginning, it's good to start with the reclined position to start the rehab. Those are the two mainstays of rehabbing the rotator cuff, is to regain that range of motion by doing the lazy stretch and then the sleeper stretch, and then also to strengthen the muscles by doing those small circle recline techniques to regain strength as well. And you should feel benefit with those exercises between 4 to 7 days after starting. It's a good idea to use a mixture of water and ice in a bag afterwards if there's discomfort or soreness to help with the inflammation and pain.
Or the ice machine, right?
Or using the ice machine. Thank you, Kyla. Definitely.